Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We are talking about musculoskeletal pain today, basically orthopedic pain. That's back pain, neck pain, knee pain, hip pain, and joint pain, tendon pain, ligament pain. So if you're suffering, especially if you've been suffering for a long time, give us a call right now here in the studio at 866-870-5752. That's 870-5752. We are here Saturdays at 10 a.m. and again at 1 p.m. And Dr. Darrow's website is chock full of information. You want to check that out at www.lastemcells.com. That's lastemcells.com. You can email him off of every page on the site and watch him performing the treatments on videos. And there's lots of articles to read. There's just tons of visuals and great information on this stuff. So before the break, we were talking about some people that have had miraculous healings with these regenerative treatments.
Yeah, you mentioned someone who works at, KPFK.
Right.
And he came in, he had been...
Terrence.
He had been playing football at Harvard and had a knee injury. Not a big deal, but guess what they did to him? They took out his entire meniscus, because that's the way they used to treat knees. And he came to me, and the femur bone and the tibia bone were not even lined up. They were, one was hanging off of the other, and he was in bad pain. He liked to hike and dance and do yoga and things like that, and he couldn't. So we treated him with regenerative medicine. He was back to it very, very quickly. So this works on even terrible kinds of things at certain times. My shoulder was operated on in 1994, and it got way worse. There was not much wrong with it. It was called impingement syndrome, which is a gobbledygook category of I don't know what's wrong, so let's just operate and call it impingement syndrome. So my arm blew up like a balloon full of fluid. I had a fever, and it didn't heal from the surgery. It took a couple of years or so. I learned about regenerative medicine. I injected my own shoulder one time. The next morning I woke up completely pain-free, full range of motion. That situation lasted me for 12 years until I re-injured it again. The next time, it took me 2 treatments and healed it again. So this is pretty amazing stuff. There are times when I've had injuries that have taken longer to heal than that. Sometimes they've taken months. But I've had my right wrist, I healed overnight, 50%, and I did a couple more self-injections. I haven't had any wrist pain in years and years and years. I can't remember the last time. And I'm going to probably go play golf today, so I'm going to be using that wrist. And I'm very happy it doesn't bark at me anymore. Personally, I've had my neck and back done by other people. I can't reach back there. I've done both my knees and shoulders with stem cells. I've done my elbows. And whenever I hurt myself, I inject myself, and I'm still on the playing field. So.
And you're not 20.
You're right. I'm 16.
See? I knew this. 866. Oh, sorry. Go ahead.
No, go ahead. We want some callers.
We want callers. We love our callers. 866-870-5752. 870-5752 right here in the studio. You can speak directly with Dr. Darrow about your pain. And chronic pain is something that probably 30 to 40% of Americans are suffering with. So when you call us and you start telling your story to Dr. Darrow, you're helping other people listening who might have very similar pain and situations to yours. So that's 866-870-5752.
So I was just going to tell you about my father, who I adore, who left the planet 24 years ago. And before he died, I went to see him one time. He lived in Santa Monica, so I'd see him all the time. And I walk in, and he's sitting there, and 90 years old, and he lifts his hand up, and he goes, "Mark, I don't understand this," because his hand was already getting kind of wrinkly. You know, the collagen was wearing out and drying up. And he goes, "I don't understand this. I'm 15 years old. Why does my hand look like this?" And ever since then, yeah, I mean, it's the truth, right? Inside we're always young. The spirit inside is always young. And I've just always taken on the attitude since my dad made me laugh. And I'm 16 years old. People say, "How old are you?" And I go, "I'm 16." And they go, "Well, you look pretty good for your age."
I thought you were going to say, "Well, you look a bit mature for your age," but, I think actually...
Well, some people do.
Well, truthfully, I think you do look really good. So should we go to see what's going on with Vince?
Vince, Dr. Marc Darrow, your wife has spinal stenosis. This is so weird, Vince, because I was just going to take a question from the internet that just came in about spinal stenosis. So this is great. I'm glad you called in. Does your wife have low back pain?
Yes, she has low back pain, and then she's got some discs that are bad in her neck also.
Okay. And does she have pain down her arms or legs?
She also has fibromyalgia, so she's kind of got pain all the time.
Okay, but she doesn't have like a radiculopathy or where the pain is shooting down her legs or down her arms, right?
It's sometimes she does, and she's on a regimen of Norco and to try to help that, but she does. She's in a lot of pain.
But it's mostly neck and back pain, would you say?
Correct.
Okay. So when people have spinal stenosis, which your wife supposedly has, and I assume that was shown by either an X-ray or an MRI, that doesn't mean that they have back pain. That doesn't mean they have anything. It just means that it looks like the nerves or the spinal cord could be being squeezed. All right? Doesn't mean they are. So let me just finish up here because this is a concept that everybody needs to get and understand. We don't diagnose based on MRIs or X-rays unless it's a broken bone or something that's obvious or a cancer. But in the musculoskeletal system, meaning the ligaments, tendons, joints, and whatnot, we can't put our money on an MRI or an X-ray. We've got to examine the area. If your wife has pain in her low back or her neck, we can probably fix that using regenerative medicine of platelets or stem cells or mixture. And spinal stenosis really does not cause low back or neck pain. The squeezing of the nerves causes radicular pain or pain down the limbs, down the arms or legs. And people with spinal stenosis, as the problem, don't typically have back or neck pain. I know that's a hard chunk to chew and to understand, but that's the way it goes. So don't get caught up in this spinal stenosis business. We have a lot of people that come in with spinal stenosis, and it's not spinal stenosis causing the problem. And the real problem is when you hear spinal stenosis, the doctor says we have to do a rotor-rooter surgery and open up those bones to get more space for the nerves to live in, and then they do the surgery, but it didn't work because they're treating the wrong issue.
And that was exactly the diagnosis from the orthopedic surgeon.
So I don't know your wife. She's not my patient. But I'm just going to tell you my personal feelings on fibromyalgia. You ready for it?
I'm ready.
Don't get mad at me.
I won't.
And everybody else who has it, don't get mad at me. I'm just one guy. It's my opinion. I have treated thousands of people over my career with fibromyalgia. None of them had fibromyalgia. Fibromyalgia is a waste paper basket diagnosis when doctors don't know what's going on. The terminology is something to the effect of widespread pain for more than 6 months. And they don't have any labs that show it, and they don't have anything that shows up on images.
That's exactly right.
So what do we do to heal them? Number one, we wean them slowly off their Norco medication, their opiums and whatever it is, the opiates, and that gets them better. We put them on an anti-inflammatory diet, an alkaline diet. No acids in the diet. And their pain starts to go away. It takes work on their part. Doctors can't heal that. Okay?
Yes, and it seems like, honestly, that the drug just masks it, and she's not getting
the drug
any better.
The drug makes the pain worse. When you take drugs like Norco, what happens is the receptors die and the pain is upregulated. The pain receptors are upregulated. You actually feel more pain. And the more of the narcotic that you take, the more pain you end up with. People come in and I say, I want to wean you off your medicine. And they go, Doc, I can't live without my medicine. And we wean them off slowly. You can't do this overnight. And their pain starts to go away. And they're flabbergasted. The other thing I heard you say is she has some disc issues in her neck. And disc issues don't cause pain typically. So traditional medicine, which is surgery and medicine, doesn't get to the core of what's really going on. So we have to be very careful. The real traditional medicine does. And that's what is called today alternative medicine. That's the real medicine. That's been around since man was on the planet. And that's natural medicine. And what I do with regenerative medicine is natural medicine. We use cells from the person's body and re-inject them into areas of injury, and we can then stimulate the tissue to grow. We use platelets and stem cells. The tissue regrows, and the pain goes away. I'm not a person who likes to have surgery on my body. It's failed me, and it's failed many, many, many of my patients throughout the years. I'm not saying a negative statement about surgeons. I love surgeons. That's hard work they do. That's big business. That's business that causes big problems. And I have patients come in almost every day that have had a surgery that failed them. They've either gotten infected or there's one leg longer than the other now. There's terrible problems with surgery. It's very invasive. Regenerative medicine is very conservative. So my book of medicine says, do no harm. That's the law of medicine, the first law. Do no harm. So you do conservative medicine first. And putting a needle into someone is pretty conservative. It's very easy. They walk into the office, we inject them, and they walk out. They drive home by themselves. They don't need anyone to come with them.
So, doctor, if from what I'm understanding from you, if we started weaning her off the Norco and changed her diet, and then there would be a stem cell or some kind of deal that you would do that could help her then?
I'm not sure she needs any injections with regenerative medicine. She just might need someone who loves her and cares for her and is willing to go through this with her, because she's not going to like what I want to do.
Okay. Okay, is that something...
People with fibromyalgia want a miracle cure. There is none. They have to do the work.
Okay. And
if she has some hot spots, if she has hot spots like low back pain or neck pain, then I can help her with, platelets and or stem cells. Because people with fibromyalgia can also have musculoskeletal pain that we can help by injecting them.
Yes. And she does have a lot of pain. So, okay.
Yeah, there's good hope. There's good hope for her if she's willing to partner up with the doctor. If she's thinking she's going to go to a doctor and get a magical cure, forget it.
Okay. Okay. Yeah, we've tried so many different things, and I was so glad to hear you. It just happened to...
It takes work.
This, so.
Yeah, it takes work to cure fibromyalgia. Well, you don't cure fibromyalgia, by the way. You can palliate it and get rid of symptoms. It's some kind of... We don't really know what causes it. We know there's more substance P. It's a neurotransmitter in the blood. That's a pain generator. So they walk around and kind of inflamed. So what we have to do is kill the inflammation, so to speak, and that's done through diet. And sometimes exercise will help out, and sometimes weight loss will help. So there's a lot of things that we can do for fibromyalgia, but the patient has to do them. And these hot spots in her neck and back, I can probably help her with by just injecting her with platelets, PRP, and or stem cells.
Well, this is really hopeful news.
Well, it's hopeful, but I have to examine her and see what we can do. If she wants to come into the office, the phone number is 800-300-9300, 800-300-9300, or she can email me and we can start a little dialogue through the website. There's a place on every page to email me, and that's www.lastemcells.com.
Okay, fantastic.
God bless you, Vince, and God bless your wife. There's good hope for her.
Thank you very much.
Thank you, Vince.
I will give you a call.
Appreciate your call.
Thank you.
Okay.
Our number is 866-870-5752 right here in the studio, 866-870-5752. Call and get your free book. It's happening now. So we're going to Ruben in Buena Park.
Hey,
Hi,
is this Ruben? Are you Ruben?
Yeah, it's Ruben. Yep.
Okay. I'm Marc Darrow. Nice to meet you. I'm a doctor who does regenerative medicine and to heal back pain. Like you have back pain, right?
Yeah, I sure do, doctor. Yeah, and I wanted I've been searching around for some PRP, and I did go to a doctor, and I was interested in PRP, but the doctor said before they could do PRP, they first they have to do a trigger point injection on my back, and then they said, and this is all prior to get to the PRP, right? And then they said, doctor said that then they would have to do a nerve ablation. I don't know, I guess where they burn the nerves, and then to do the PRP with ozone. So I was just kind of like, I don't know, is all that necessary just to get to the PRP? And then if I do get to the PRP, what is ozone? I mean, do I need ozone? Or it sounds like a breakdancer name. You know what I'm saying?
I'm just going to give you my opinion. If that doctor has good success with patients, then you should go to him. But my opinion is, number one, nerve ablation is a big deal. I would never do that. And it certainly wouldn't be one of the first steps. And trigger points don't work. I don't care what anybody says. That's just injecting typically lidocaine and a steroid in the area. To me, that's...
You know what, and that's why I kind of denied it, and I know the doctor kind of got... 'cause I know it's all about money, man, when you go to the doctor, kind of got mad and want the trigger point. I just said, I'll take my Tylenol when I get home, man. But anyways, but the doctor had said, in order to do the PRP, I have to do the nerve to burn the nerves, whatever. And I know that's a big deal, So I was like, is that necessary? So, you know what?
No,
that's why
definitely not. I mean, the way to start out is someone who knows regenerative medicine well can touch your back and tell you in about 2 seconds if they can help you. And PRP, if it is tender, is a very good way to start. And
okay.
For people,
okay, so don't. So yeah, it's a good thing I walked out there, then, right? Because you don't need all that stuff, right? I mean, start off with the PRP. Sorry about the noise.
Well, I don't know. I don't know the doctor, and maybe he's amazing, and maybe he heals every person that comes to see him. But that's not what I would do.
But that's not a,
if you were listening, you heard me say that in medicine we do conservative things first. What's conservative?
Yeah, those are the opposite.
Massage. Right? Sorry?
Mm-hmm.
You do the
nerve,
easy things.
That nerve thing. Yeah, that thing's big time, right? Burn your
That's
nerve?
big time. That's big time.
Oh, okay, so, great. Okay, man, it sounds good. Well, you know what? Then I just wanted to ask you, like I said, I've been searching around, and I have you on my radar also. So, but I did go kind of cheated on you, Doc. So I was being honest, and then when the doctor told me all about this, I said I'm going to call you up again and see what you think. So I'm kind of narrowing it down. I'm waiting for that stimulus check so I can use my stimulus money for you, doctor. To be honest, So
all right, Ruben, God bless you. We're going to go to Jerry.
Thank you, Ruben. Appreciate your call. That was great. Okay, Jerry in Claremont.
Hey, Jerry, I understand. Yeah, this is Dr. Marc Darrow. I understand that your shoulder bothers you. Hey, Jerry, can you get off your speakerphone or Bluetooth? It's hard to hear you.
Can you hear me better?
Oh, yeah. So how long has your shoulder bothered you?
Since August. I fell in my shoulder. I've been doing 6 to 8 weeks of therapy at home.
Okay.
It improved greatly. I've had full extension, but here's the problem. I had an MRI. They said I have a total massive thickness tear of the left supraspinatus with muscle retraction. They say there's a partial tear of the subscapularis tendon and a probable, almost complete tear of the long head of the biceps tendon. The surgeon said it might be difficult to reattach it, so as an alternative, they're recommending a superior capsular reconstruction.
Okay.
To fill in that 48 millimeters.
Gotcha.
Now, I mentioned PRP to him, and he said, well, he didn't think PRP was a good option. Then I said stem cells, and he said something about, well, you don't know where they're going to grow. I didn't really deal with it.
Okay. So number one, Jerry, you don't go to a surgeon to get regenerative medicine. Number one, they don't believe in it. Some of them do it, but they don't believe in it. And after they try it once, they say it didn't work and now you need surgery. Okay? So I wouldn't go to an orthopedic surgeon to get PRP or stem cells or ask them anything about it. So anything they tell my patients, I go read the research. Don't listen to an orthopedic surgeon who doesn't do it. They don't know what it's about. Just like don't come to me to get surgery. That's not what I'm doing. Do you get it?
Yeah.
I could do a surgery on you, but I'm not the best guy to do it. I got a lot more to tell you, but we're stuck here. Go to the website and email me from there, and we'll talk more, Jerry. That's www.lastemcells.com. Thank you, Nita, and everyone else. God bless you all.
Thank you, Alex. Thank you, Suzette. And remember to listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. I'm your host, Nita Valens, and we will thank you for listening and see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, To take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.